forpay.org. This is Consumers Doctor, Dr. Vingala. Today's topic, fighting disparities in healthcare. This is from the recent ARP Journal Bulletin. COVID revealed how race, age, and class affect medical care, and it's time to close the gap. Let's look into it, folks. COVID-19 has taken enormous toll on all of us. It has been much more tragic toll in older blacks, Hispanics, and other people of color. Blacks and Hispanics, Americans, have been hospitalized and have died at higher rates. Americans 50 and older account for nearly 95% of the COVID deaths. Yes. And nursing homes with mostly Black and Hispanic patients have suffered 3 times the rate of deaths than others. Center for Disease Control and Prevention data shows that the percentage of people in these groups who have received vaccine lags far behind the percentage of those eligible and often of non-Hispanic whites. These disparities are not random. They're not random, folks. They're as a result of a long history of inequality due to lack of social, economic, and political opportunities. Folks. It is time for us to address these long-standing disparities. Black Americans suffer higher rates of chronic illnesses such as hypertension, diabetes, as well as higher rates of obesity than US population overall. Higher rates of chronic diseases contribute to the fact that dementia, including Alzheimer's disease, is much more prevalent among the African Americans than whites. Hispanic Americans are much less likely to have health insurance than other major population group. They also get an average fewer screenings than non-Hispanic whites for colorectal cancer. Yes. And they suffer above average rates of diabetes, higher rates of obesity, and dangerous rates of high blood pressure, folks. According to the Kellogg Foundation study, eliminating health disparities by 2050 would save more than $150 billion in Medicare costs and reduce loss of productivity by 80 billion, folks, 80 billion. That could save American economy more than 230 billion per year. Yes. AARP, AARP is working to lower the cost of the prescription drugs. People of color experience higher rates of chronic illnesses, diabetes, hypertension, heart disease. They are more reliant on drugs that are hit harder by the higher costs of the drug. AARP is also working to help people adopt healthier lifestyles to reduce instances of chronic conditions such as obesity, diabetes, heart disease, asthma, and more often lack of exercise, poor nutrition, limited access to health care, and environmental factors, folks. So, forpay.org is focusing on access to the healthcare. Foremost organization is striving really hard to change the healthcare as we see it, folks, because healthcare, we have the best healthcare, but the access to healthcare is limited because of the rules and regulations what we have. Department of HHS, Health and Human Services, is pumping the funds into the insurers rather than investing in Americans. Investing in Americans is a primary goal of forpay.org. Forpay.org is a foremost organization reimbursement premium adjusted yields. Basically what it means, everybody should have a deductible health insurance along with health savings so everybody can put money aside into the health savings. We are striving really hard to change the payment system, and we're also looking at the affordability, competition, and transparency. I think the healthcare needs to focus on affordability, competition, and transparency, not consolidation, not, again, taking away the competition. We want more access, not less access. So I would like to, as a consumer's doctor, every day I've been trying to see if we can revolutionize the healthcare access. Revolutionize the healthcare access, folks. It can be done. It is all in your hands, folks, consumers' hands. And we want to have a Medicare Choice Plus. We want to have a Medicaid Choice Plus. Medicare Choice Plus basically empowers the consumer. Medicaid Choice Plus empowers the consumer. That's what we want. We want the consumers to play an active role. And I foresee consumers are the only segment they can lower the cost. We haven't had it since Lyndon Johnson introduced the Medicare in 1960s. We haven't changed healthcare as we know it. It's a time has come. We need to focus on consumer, not the insurers. Providers are doing their best job they can, but we need some reform, folks. We need some reforms, and we need to focus on the consumer. Our main attention, and they're the only one that can lower the cost. Not anyone. Not anyone. Even the government can't. We need a public-private partnership. That's what we need to focus on. Guys, thank you for listening. And as a consumer's doctor, I'll continue to talk about healthcare access, healthcare, technology on your side, folks. Technology on consumer side. No matter what anybody says, technology is the ultimate solution for the healthcare access. We'll see you in the next segment. Goodbye. I love you guys. We'll see you next time. Bye.